So I got a lot of questions about Depo Provera, including this one. So I just wanted to go over Depo as a form of birth control because I do think it's an excellent form of birth control, and these are all good questions. So Depo is an excellent option for birth control because it's not something you have to take every day. So you get an injection every 3 months. It takes about 7 days to become effective, and the bleeding can be a little bit abnormal in the beginning, but usually by the second shot, the bleeding levels out, and by a year, usually earlier than that, you don't have a period at all, which is fine. There's nothing wrong with not having a period once you are on birth control. So the biggest thing about Depo is the side effects, right? So there are progesterone side effects that are common for any birth control that has progesterone, which I'm going to list here. And then there are the ones that are very specific to Depo that I feel like most people are worried about. So the big three are the weight gain, return to fertility, and bone loss. So in terms of the bone loss, it has been found that it is fully reversible once you stop the Depo Provera, and we have a lot of recommendations saying that in and of itself is not a reason to limit how long you're on Depo. So a lot of people will say my doctor took me off after 2 years or 5 years, but if there are no good alternatives and you do well on Depo, then there's no reason to stop. Just because of that risk of bone loss, just because it is reversible. So we weigh the benefits and risk of you getting pregnant versus doing the Depo. The other one is the return to fertility. So that is known to happen with Depo, and it's actually related to your weight. So higher weight means the suppression of ovulation, which is how Depo works, lasts longer. So some women have no delay to fertility, right? As soon as they miss their shot, boom, they're pregnant. But it can be anywhere up to 18 months. It just depends on the person. So it's one that if you are planning to get pregnant in 1 or 2 years after you get off your birth control, Depo may not be a good option for you. So the last one is weight gain. And the way that Depo causes weight gain is because of the progesterone, and it increases your appetite. So I always tell patients, if it's something that you know is usually something you can prevent, the actual evidence says that it's about 5 pounds maximum over a year that you gain from the hormone itself. But we hear different things from patients, but it's not a reason to not use Depo Provera. It's just something to be aware of. Overall, excellent form of birth control. Let me know if you guys have any other questions in the comments, and like and follow for more.